All right. Well, welcome everyone to the Region 7 Planning and Policy Council meeting. My name is Kirby Fye. I'm with the department. This is our first meeting of fiscal year 22. I can't believe that. Thank you all for taking the time out of your day to join us this morning. Just a few things I need to go over before we get started. This meeting is being held virtually per the Open Meetings Act. We just felt as a council it was the safest option right now for us to continue to meet virtually. We'll reassess again next quarter, but for now it's being held virtually per the Open Meetings Act. With that being said, this meeting is being recorded and it will be posted to the department website within the next day or two. Please mute your phones or your computers if you're not speaking, just to prevent any feedback from coming through. And please also state your name when you're presenting or asking a question. Let me see here. Butch, do you want to go ahead and go through attendance since you were taking down the names as people joined, or do you want me to do it?
I could do it. I've been writing names down. So let me go through the names that I have in alphabetical order. And then we'll, well, more or less alphabetical order. And then if your name's not called, we'll get you to speak up, okay? So I have Bartholomew Allen, Lindsay Blevins, Susan Carruthers, Lincoln Kaufman, Mary Neal, Kevin Spratlin, Tom Starling, Jakarta Suggs, and then I have Albert Richardson, Mackenzie Selby, Heather Vestal, and Erin Gillian. I know I'm messing up her name terribly. And then with the state, I have okay, and then with the state, I have Kirby Fye, Avis Easley, Kurt Hipple, and Zach Blair. I think there's at least one other telephone on.
Butch and Kristen Veloff, she's with the department as well. Zach's going to introduce her.
Kristen Veloff, that's a neat name.
Yes.
Okay. Okay, is that the other person on the telephone?
No, she's joined. Did you get Heather Vestal from the telephone?
Oh,
Kristen is joined. There she is.
K-R-Y. So is that a state-approved background, Kristen? Because I was being audited a few months ago by, and that was the accounting dude's background. And I just figure that, you know, the state doesn't let you just pick any background.
No, but the good thing is at least I have Zach to vouch for me. My name may sound, my heritage is actually Bulgarian, but I've got Zach to vouch for me. So he at least knows I'm good company.
We'll be the judge of that. No,
I think there are a lot of people that say if I vouch for them, they don't hold that in high regard. So I'm not sure I'd advertise that.
So good to know.
So anyways, after Kristen Veloff, I don't have anybody else listed who's on the call. So if you didn't hear your name, give me a holler and I'll or let's put your name in the chat if but I think we got all the people that are logged in. And I know sometimes people are the telephone number. I'm afraid we might be missing one person. But that sounds like everybody's there. Sounds like everybody's checked in, y'all.
Okay. Kirby?
Handing it over to you, Bart.
All right. Shelby, it looks like you're frozen on your screen. Mackenzie, I'm sorry. I didn't know if you can still hear us or not.
Yeah, I can. I actually had my video off.
Okay, cool. No problem. No problem. I just wanted to make sure this is your first time.
Thank you.
Well, good morning, good afternoon to everyone. My name is Bartholomew Allen. I am the chair of Region 7, and this is our Region 7 quarterly meeting. Today is Tuesday, July 27th, and we'll call everything to order. Most of you probably have gotten the email from Butch on last week with the minutes. And if we'd like to, I don't know if we want to go around and introduce ourselves, or I don't know. How did we do it last time? I'm sorry, I'm drawing a blank on all of these meetings. I don't know how we do them. Do we introduce ourselves, Butch? Have we been going around, everyone says hey, or what?
I think we've just been doing attendance, and then we can do kind of a networking thing at the end for newbies on the call. But you can run it any way you feel fit, though.
No, I'm okay. And you have to apologize. I have literally probably about 4 or 5 Zoom meetings every week, and everyone does stuff differently. So I just forget which meeting this is. So I apologize. So yeah, we'll do that. If everyone has had a minute, we'll go over the minutes from the last meeting, and then we will need a motion to approve those minutes. So if you have a chance, take a look at them, and if I can get a motion on the floor to approve them after we've reviewed them, that'll be great. All right. Can I get a motion to approve the minutes from last meeting? And please state your name once you approve them.
Motion to approve, Lincoln Kaufman.
All right, thank you, Lincoln. Do we have a second on the floor?
Second, Mary Neal.
Thank you, Mary. All right. Documents overview. So you have your agenda before you, and after I get through talking, Kirby will come back and she'll introduce the updates from the state, and then she'll introduce Mr. Zach, and then we'll kind of go from there, okay? So Kirby, are you still with us?
Oh, I'm here.
You're here. I know you're here.
Let me pull up my report. All right, just a few updates since we last met. I can't believe the last time we met was April, so long ago. So I'll be sending out an email. Bart, you'll receive this, and Mary, you'll receive this in probably the next week or so, but I just wanted to get it all on your minds now. I'll be working on the FY21 Joint Annual Report. Please identify your region's key accomplishments achieved and challenges faced from July 1, 2020 through June 30th, 2021, and your region's future plans. Each year, a joint annual report is produced and delivered to the governor and state legislature to highlight accomplishments, challenges, and plans for the future. The joint annual report is a collaborative effort between the department, the regional councils, and the statewide councils. Please submit this information to me via email no later than September 17th. Year 3, FY22 of the 3-year plan is in progress. Regional councils will have an opportunity to review within the coming weeks. Development of the FY22 mental health block grant is also underway. Statewide and regional councils will have an opportunity to review that document as well. The 2021 legislative summary is complete and has been posted to the department website. I've included the link in my update, which I'll send to you, Butch, to include in your minutes to access the legislative summary. Zach is going to go into more detail on that after my update. And lastly, the department is releasing a new certification for peer support specialists designed specifically for young adults with lived experience of mental health and/or substance use challenges. The Certified Young Adult Peer Support Specialist program is tailored to young adults in both design and language with a target age range of 18 to 30 and a requirement of 1 year in recovery. The program includes a 1-week, 40-hour training session covering topics including responsibilities and expectations, strategic sharing, youth empowerment, positive youth development, the ladder of youth voice, and trauma-informed care. Through this training, specialists will gain the knowledge needed to provide youth and young adult friendly peer support services to people under the age of 30. Peers certified through this program are also required to complete service hours and continuing education to maintain their certification. This program joins the department's current offerings in peer certification, the Certified Peer Recovery Specialist, and the Certified Family Support Specialist. And I've included a link on our department website where you can access more information about this program. And that is what I have.
Bartholomew, you're muted.
I knew that. I was just testing you guys. That's all. Thank you, Kirby. I appreciate it. Does anyone have any questions for Kirby? Kirby, I have a question. I couldn't remember during the discussion if an individual obtained the youth CPRS certification, and are they able to get both certifications if they're considered an adult as well? I mean, if they have the CPRS
I think it's just
already.
the age range. So once they're at a certain age, then they would just be a certified peer support specialist, I believe.
So after
So this is for peer, or this is for young adults.
Okay. All right.
Go ahead.
No, I was just saying thank you. Go ahead.
You're welcome. I was going to say there's more information about this. I believe this question was also brought up at the statewide council. And there is more information about that in the link. Sorry, I have a teething baby in the background and she's screaming. I'm sorry.
Oh, it's no problem. It's no problem.
We like baby noises.
Mr. Zach Blair, you can have the floor. Mr. Zach will be presenting to us the 2021 legislative summary. It's all yours.
Thank you, sir. I appreciate it, and happy to be with y'all this morning. I'm going to give out my standard disclaimer that I do on most meetings. My German Shepherd is the best doorbell anyone could ever have, and if he senses someone outside the door, he will probably announce his presence on the call. So hopefully we can keep him calm and not barking while I'm going through this, but I wouldn't hold my breath, unfortunately, because he tends to like to talk during the meetings that I'm on.
Gotcha.
Hey, Zach, just 1 second. Will you have this in a form that I can copy and paste, or do I need to write?
Absolutely.
Okay,
yes, sir.
great.
It is on our website, published, and Kirby has sent the link already. So the document that I will be sharing with y'all will be the exact same as the document that is posted on our website, minus the highlights of the bills that I'm going to show and run through today when we're talking about it.
And Butch, for your minutes, you can just put that Zach Blair reviewed the legislative summary and then include the link. I'll send it to you.
Okay, thanks.
That would be a lot. These minutes would be pages long, probably. So.
Yeah.
And I'm a bit of a talker, so I'm sure that doesn't help anything either.
Okay, guys.
The next thing I want to do before I share my screen and the document, Kristen Veloff, who is a Region 7 native, she's, I'm sure, enjoying getting to meet with some folks from back home. She has joined our department. She did at the beginning of June. Kristen and I actually had several sessions together at DCS before, and we've told everyone we're just getting the gang back together. So we're excited that she has joined our department. She was at the Tennessee Board of Regents for a while. She was the Assistant Vice Chancellor for Government Relations there. And we were very thrilled to be able to steal her fair and square and have some more legislative and rule support at the department. We were unfortunately long overdue for that, but we were glad that the timing worked out. Kristen was interested in coming over and working with us. So, Kristen, if you want to say hello to the group, then we'll move on.
Hello, everyone. I am so excited about getting to work with each and every one of you. I look forward to meeting you, hopefully in person sometime soon. But please let me know if there's anything you need. I'm here to help. I'm here to assist Zach and basically make Zach look good. So let me know how I can help.
Unfortunately for Kristen, trying to make me look good is a pretty impossible scenario. So hopefully she knows she has her work cut out for her. But luckily she's had to deal with me in years previous. So I think she'll pick right up and get to where we need to go. I'm going to go ahead and share my legislative summary document with you. 1 second. Okay, is everyone able to see that? Kristen, I can see your face if you can nod your head. Thank you. Okay, so I'm going to just highlight, obviously there are a lot of bills on here, but I'm going to highlight some of the ones that I thought the councils would be interested in. And if you have any questions about other bills, other legislation that's on here, please don't hesitate to ask, or if you have questions about the ones that I talk about, please don't hesitate to ask. But we'll go through this, and just let me know if you have questions as we go through, or if you have anything that you want to put in the chat, we'll be watching that too for questions. So Kirby, if someone, because I'm sharing my screen, if you see something in the chat, if you don't mind letting me know, I would appreciate it. Okay, the first bill on this list is not a bill actually, but it's a joint resolution. It's House Joint Resolution 175. I know many of you probably knew and worked with Ellen Abbott, who we lost at the beginning of the year, and the legislature, in a very fitting tribute, I believe, honored her with a joint resolution. And we thought it was important to make this the very first thing that we listed on the legislative summary. But Ellen was a huge part of our department, a big advocate for the criminal justice population that had mental health issues or substance use disorder, and we miss her dearly. And we're very excited and happy that the legislature decided to honor her in this way. But definitely worth a read if you have some time, especially for those that knew and worked with her. But that's definitely something that we felt was important to include on the summary and make sure it was the very first piece of legislative action that was highlighted. Moving on to the next bill, Senate Bill 753, House Bill 81, now Public Chapter 62. This was the administration bill that we proposed through the governor's process and requested. It does a couple things that I think you'll be interested in, but the thing that's really important for the regional councils is the membership structure that you as a council employ. And we shared this with the councils as we were going through the legislative proposal process last year. And right on cue, there he is. Excuse me for a second as I try to settle him down. The part about the bill that I think is relevant to the councils, in state law, the statewide council is actually enumerated, but the regional councils are not in state statute. By federal block grant requirements and state law, the statewide council is required to have a majority of members that are service recipients, former service recipients, or family members of service recipients. There was some confusion about whether that requirement extended down to the regional councils when we were going through the previous sunset audit. And we also recognize that the councils are regionally and citizen driven, and we want to make sure that we respect that. And there are maybe some folks that don't want to necessarily share that they are service recipients or previous service recipients. So the idea of this change was to both clarify in law that the regional councils are encouraged to make sure that that is something that they are looking at when they make appointments, but it's not the same requirement that's enumerated in law for the statewide council. So wanted to maintain the intent, but also recognize that the regional councils do need to have some flexibility in their appointments, since you are making appointments rather than the department making the appointments. The other thing that this bill did that I think people would be interested to know, there was some confusion about licensed alcohol and drug abuse counselors and their ability to provide telehealth or telemedicine services. In our bill, we requested to make sure that that was abundantly clear, even though the legislature did mention that in the broad telehealth bill during the special session that was held. There was some confusion and some unclear nature of the statute. So this just makes it very clear that licensed alcohol and drug abuse counselors are allowed to provide telehealth and telemedicine services. And let me try to scroll down to the next page. Are y'all still able to see my screen? Okay, good. It changed windows on me. The last part of, the last bill listed on page 2, Senate Bill 739, House Bill 73. This creates the K-12 Mental Health Trust Fund. If you remember back during March and April, the governor reintroduced the Mental Health Trust Fund legislation and made it part of the amended budget. This places $250 million into a trust fund. 225 of that makes up the corpus of the trust, which is allowed to grow on an annual basis. And then 10% of the money, $25 million, goes into the account that is allowed to be used for services. So the intent is that there was a lot of non-recurring funding in the budget, and this was a creative way to use non-recurring funding and turn it into recurring by being able to fund programs out of the proceeds and interest that the trust generates on a yearly basis. So on an annual basis, what will happen is the growth on the 225 million will be transferred into the, what I kind of deem the operating account, to be able to be used for services in with K-12 students throughout the state. So the department is in the process of structuring a needs assessment to be able to take a look at the needs throughout the state and then deploy those services as soon as possible. So something that we're very, very grateful for, very excited about moving forward and trying to, go ahead. Sorry, did somebody have something? Sorry, I thought I heard somebody make a comment. Very excited about this, very excited about the prospects of the services that this will provide. And obviously a large financial investment by the state to be able to do this work. So we're very grateful for that. Moving on to page 4, Senate Bill 207, House Bill 215 deals with recovery residences primarily. It allows public notice requirements for municipalities if they have certain ordinances related to housing and posting requirements. The big thing, though, that it does is requires recovery residences in order to receive referrals from the court and from other treatment facilities to be part of a national or state accrediting body that provides standards for recovery residences. It doesn't require those residences to be certified, but the referral process changes if for some reason that recovery residence is not certified. So if you have recovery housing or you're a provider of recovery housing, I think this bill would be very important to take a look at. And the department, as a result, will be required to maintain a list of those residences, of the organizations, that certify the residences. Also, those residences that receive any type of state or federal government funding are also considered approved as part of this bill too. So this is one that we would encourage folks to take a look at, again, if you are in the business of providing recovery residences for folks with substance use disorder. Senate Bill 558, House Bill 1132. This creates the Opioid Abatement Council. What this will do is it authorizes the Attorney General for the state to settle claims against opioid manufacturers. And you probably heard that there is a agreement on a settlement that hasn't been finalized yet. But what will happen is this bill sets out how funds are to be distributed and creates a council for opioid abatement for the funds that go to the state in order to be distributed in an equitable manner for the purpose of opioid abatement in Tennessee. So that's something that is going to be ongoing for a number of years, especially as these lawsuits get settled and funding comes to the state as a result. And this council will assist in trying to meet that need. Senate Bill 118, House Bill 490 does two things. It creates a medical cannabis commission. It does not legalize medical cannabis in Tennessee, but it requires the commission to submit a plan to the legislature if medical cannabis were to be descheduled by the federal government. It also legalizes certain substances that have 0.9 THC rather than 0.3 if they have certain health conditions and have physician recommendation to do so after other treatments are exhausted. So something that we will continue to see. I'm sure a lot of movement in the medical cannabis and perhaps the recreational cannabis part of our laws. I think we're still a little ways away, but obviously this is part of the conversation, and will continue to get a lot of attention in the next few years, I believe. The top of page 5, Senate Bill 1265, House Bill 508. This authorizes unlicensed graduates and graduate students in medical training programs to be able to provide telehealth services. Recognized during the COVID pandemic that these students that are being supervised to get clinical hours have a difficulty being able to get their hours unless there is an option to do that virtually. And state law was clarified to make sure that it was clear that those folks are going to be able to provide telehealth services in order to get their hours under the supervision of the licensed professional that they're working with. Moving on to page, I'll make sure I didn't miss anything here. Moving on to page 8. You probably heard back last year as we were going through our review by the Comptroller's office, and then at the beginning of this year, the department and all other state agencies have to go through a periodic review process by the legislature, and the legislature actually has to extend the existence of the governmental entity as those reviews happen. And we were very grateful and pleased that both the department and the Statewide Planning and Policy Council were extended to June 30th of 2025. Again, this is a routine matter that happens, but something that we have to take very seriously to make sure that folks are seeing that we're doing the work that we're required to do, that we're following policy and procedure and state law. And we were able to get a good report from the legislature, and as a result, we're extended. So very excited about that. We love that the department will be able to continue to exist and do the work that we do. The last bill on this page, Senate Bill 773, House Bill 779. This was a bill that the administration proposed to be able to capture some of the provisions from the executive orders during the COVID pandemic. Most of the bill here applies to the Department of Labor, but there is one piece that we requested in this bill, and it allows the transportation agent to accept an electronic copy of a certificate of need when transporting a patient to a psychiatric hospital. So previously, the sheriff's deputy or the transportation agency in the folks that were transporting those patients to the psychiatric hospitals were required to get a paper copy. Obviously, with telehealth, telemedicine being available, some of those documents are electronically created and submitted. So this just allows the transportation agent to accept an electronic copy when transporting that patient. Moving on to page 10, Senate Bill 767 and House Bill 784, and then the next bill, Senate Bill 768 and House Bill 785. These were the two bills that the governor proposed to enact criminal justice reform in Tennessee. I will not pretend to be an expert in criminal justice matters, but these are two really big and important bills that happened during the legislative session. The first one is really pertaining to community-based alternatives to incarceration, so that people can be diverted from incarceration and into other services and potential placements and supervision. And then the second bill relates to reentry and makes changes for incarcerated individuals who are being released currently or soon to be released, and makes that part of the planning as they fulfill and carry out their sentence there. So again, two big pieces of legislation that we thought were important to include on this summary. And then finally, I think those are all the bills that I've highlighted, and I'm happy to answer questions. And if you saw anything else on the list that you'd like me to go through, I'm happy to do that as well.
Hey, Zach,
Yes, sir.
thanks for that.
You're very welcome.
Okay, I've got a bit of an echo. Let me do some here. Is that better?
You definitely sound fine on this end.
Okay. I'm just wondering if there's I did a quick clicking on the thing about the graduate student thing. Is there a listing of professions or like, does that include
So let me.
social work, master social work and stuff like that? Psychology grads?
I believe it does. Let me, I'm going to pull up the bill real quick and just see if that's specifically enumerated. So this adds, and this is the actual provision. It says a graduate who has completed or a student actively enrolled in a professional training program, the educational standards of which meet the training requirements for a license under this title. So that's Title 63. So professions under Title 63 or Title 68, as long as the graduate student is being supervised and they're providing the telehealth services for the purpose of obtaining hours required for licensure or other educational requirements. So as long as they are seeking a license under Title 68 or Title 63, this should apply to that person. And I'm not sure any other professionals that are in our realm that would be licensed outside of those two titles.
Thank you.
You're welcome. Anybody else? Well, if silence prevails, I just want to say thanks for the time. I know this is a quite a lengthy presentation, but I hope it was helpful, and I hope that document's helpful as you review legislation from last year. And I hope everyone has a wonderful day and look forward to seeing you again soon.
Thank you, Zach. Thank you so much. Kirby posted the link in the group chat for all those who were wondering how they can get updates. It is on the department website, but if you go to the group chat, you can also access it there. Does anybody have any questions, comments? All right, so we did not have a presentation today. We're going to bypass that part. However, anyone that has any updates around the region, please feel free to speak. Things that are going on in your respective agencies or departments. You can have this platform now to kind of update everyone. Nothing? There's nothing going on in Shelby County?
This is just some housekeeping. Just since the meeting will wind down, I did pick up that Lawrence and Zakia entered the meeting. So I have them as being in attendance. Was there anybody else who wasn't here when the roll was called who are now here in the meeting? I think I've caught everybody. Okay, great.
All right. Anybody? Were you about to say something?
So, Bart, this is Kevin.
Hey, yeah, go ahead, Kevin.
Just one update that the group may be aware of, but as part of the American Rescue Plan Act, CMS appropriated $15 million to states for planning grants to develop, prepare for, and implement mobile crisis intervention services. And the deadline for that was last week. the state Medicaid agency. So for us, TennCare would have had to apply for this planning grant to look at our mobile crisis system and see if we would be looking at a further evolution of that system. And jointly, TennCare and the Tennessee Department of Mental Health and Substance Abuse Services did not apply for that planning grant funds. So we sent that to our legislators, and we got some feedback from TDMH that says that TDMH and TennCare jointly fund the statewide crisis services center. Excuse me. They have 13 crisis center providers, which operate 24/7, 365. Statewide mobile response teams who evaluate those in crisis, and 7 walk-in centers, and that they saw no need based on this continuum-based crisis service program to apply for a planning grant to look further into that system. So just an FYI to everyone, that the state has chosen not to plan further about the mobile crisis system.
And Kevin, are we talking about the expansion of your particular department?
That's certainly something that we thought the state would consider, is if there is a need for multidisciplinary response to behavioral health crises in our communities throughout the state. And that was what we advocated for with the state, and asked them to consider these planning grants to look into that, but they've chosen to not request those funds.
Okay. Thank you, Kevin. Anyone else? Any updates?
Hey guys, it's Lindsay. So I don't know if I have anything super like enlightening for the group, but just some general, Lakeside updates. We're continuing to do many things virtually around here. I thought if you would have asked me a month ago, I really would have thought things were, going in the opposite direction. But I think, we're kind of to pull it back in a little bit. So we've got, Zoom lunch and learns that we're doing every month for people in the community, that they can connect, get some education or CEs if that's something that they need, or just learn about whatever topic we have going on. We have a variety of virtual programming that we still have to offer in the outpatient setting for adults and adolescents. If people are having barriers, to transportation, scheduling conflicts, or, just as a precaution due to COVID and things like that, we allow virtual opportunities for outpatient. We are a hospital, and so we are still not allowed to have visitation or traditional visitation on our main campus. So family sessions and visitation is offered via Zoom when that's appropriate for our patients, so they can still stay connected. As for our inpatient settings, we've been functioning the same as we've always been for the most part, since all of this started. We are open 24/7 in our admissions department, doing our due diligence to make sure that we're screening everybody once they arrive onto our campus, inside the buildings, in our intake department, for temperatures and things of that nature, to provide a safe environment for all of our patients. The other new thing, and I think I might have mentioned it in April, but that was, like you guys are all saying, way too long ago that I can't recall. We opened up an outpatient clinic in East Memphis, and that's for currently adult only IOP, intensive outpatient, and partial hospitalization. And so we have several physicians that'll practice out of that office. And so we're currently credentialed with all of the commercial insurance policies in TRICARE, and we are working hard to get credentialed out there with our TennCare MCOs as well. That process just seems to take a little bit longer. So we're hoping to serve, many more people in that outpatient clinic. The proximity to, other areas in Memphis, I think, is a little bit more conducive. We're out, the main campus is out a little bit further from, city limits and things like that. So that's another opportunity for a connection to resources. We're also looking at some transitions here on campus, with how we're doing things clinically and things like that. And we are having conversations and are hoping to open or launch a specialty track for the LGBTQ population. And so that's currently what we're looking at is starting with adults, inpatient and outpatient opportunities. So that should hopefully come to fruition in the next couple of months. And I can kind of keep you guys posted or updated as we have our next meeting next quarter as to where that stands. Because at that point, we should be, fingers crossed, I'm very optimistic that things always go according to plan. And we've learned this past year that that's not always the case. So I'm hoping that things will be open in this next quarter so I can update you guys. But we are really looking forward to partnering with the advocacy centers and the LGBTQ population, because I feel like there's definitely a need out there for higher levels of care outside of individual therapy. So more to come on that.
Thank you so much, Lindsay. I appreciate it.
Yeah, I'll talk for you, Bart, if you need something.
Hey, Lindsay, what's the address for the new site?
The what? I didn't hear you.
What's the address for the new Lakeside?
It's 1083 West Rex Road, and that's Memphis, 38119. I can put it in the chat too.
Yeah, that'd be great. And so if we're having members that need to be admitted, they don't have to go to the main campus?
So that's outpatient only.
Oh, outpatient only. Okay, I got you.
Correct. So it's going to be intensive outpatient and partial hospitalization. Most of the patients that are wanting to go there can either be assessed virtually or they can go there for an assessment, or some of them start on our main campus and end up over there as well. But it is not inpatient. It's only an outpatient clinic office.
All right. Hey, Zakia, go ahead.
I just wanted to ask Lindsay a question again. I just wanted to make sure, and you said right now the insurance coverage is TRICARE and you guys are working to get TennCare on board.
Yeah, so we can take most commercial insurance policies in TRICARE, but we currently cannot accept any TennCare at that location.
Yes, ma'am. Thank you.
But we do take TennCare and, the regular insurances at our main campus for outpatient.
That's good.
Hey, this is Tom Starling. I just wanted to let you know that as we're, in a hybrid situation, we're looking at getting back to the office. And speaking of that, we are, being a professional beggar, we're looking for donated office space. It might just be like a 10 by 10 room or 8 by 8 storage closet, but we would love to have our two staff come in 2 or 3 days a week, enjoy some professional collegiality. We would pay for the office supplies. We're going to pay for any printing, but just a place where they could store some of their curriculum and programming materials. Most of them are, one is doing suicide prevention out in the community, and the other is focused on our student-based mental health programs in schools. Maybe we could exchange training for rent. For a couple of years is what we're looking for. So if any of you are having other staff work remotely and you just happen to have a little extra office space, maybe we'll be able to pay next year. But we are looking at, having a couple of people share an office 2 or 3 days a week, if you could help us out. And I'll put my email in the chat real quick for that. And also, just a reminder that we have launched a mental health directory. So you may want to go on, if you haven't done so already, to make sure that your information is on there and that it's clear. The web address is midsouthmentalhealth.org. And we're not so much focused on individual providers as much as we are some of the hospitals, community mental health centers, recovery centers, peer centers, support groups. But please go to midsouthmentalhealth.org and let us know what you think. And again, my email's in there if you have a problem changing your profile in any way. Thanks.
Thank you, Tom. I appreciate it.
Hey, Tom, what
Anyone-
regions are you looking for? Are you looking for, I guess you're looking for a space here in the Shelby County area?
Yeah, not so much, in the core downtown, but if it was just, anything midtown or east, that would be preferable just based on where our current staff is located.
Yeah.
Like I said, they do a lot of training in the greater Memphis area and even, rural West Tennessee. So yeah, just kind of looking for a place like that. They may only be in the office 2 or 3 days a week, but they do have, some storage needs for their materials.
Okay. Anyone else have anything they would like to share with the council? Good information, everyone. Yes, ma'am, Mrs. Akia.
Okay, so Mr. Bart, I think you've probably already given us this information, but I just want to ask again, what's the requirement if we have any peers that want to come out and visit you all over at Barksdale?
Oh, yeah, no problem. So what happens is they're usually referred by a clinician, one of their licensed therapists. They can go online and do it, or they can stop by. We're asking people call first. We're just trying to reduce the traffic here in the agency. And what'll happen is we'll talk with with the person referring and with that individual, and we'll ask them a series of questions, an assessment, in-house assessment. And then we'll just kind of go from there. It's really simple, really easy, but they do have to be referred by a licensed clinician.
Okay. Because I have somebody that literally came, I have 2 people that we got set up and everything, and they literally came the day before the shutdown or our shutdown here. So they didn't get to come back and they're wanting to come back. So I just didn't know if we had to start the referral process over again for them. And also if you have any requirements like people having to already be vaccinated, or if there's a shift in the days that they're available to attend, because I have some people that really were wanting to come back. So.
Right. So it's crazy because right before we shut down, there was already a list, but then we had some individuals, and we're probably talking about the same people that were slated to come the actual next week. What you can do is offline. Do you still have my cell phone number? Not, I can put.
I don't. I think I lost your card. I'm sorry. Yes, sir.
All right, no problem. But what I'll do is offline, you and I can talk, and you can give me those names and we'll check them out, and we'll see if we can get those in here. What we are asking, of course, we're not making it mandatory, but I'm strongly encouraging those who do want to attend to consider being vaccinated. I know everyone has their ideals and their preferences on whether or not they should be vaccinated, but I want people to strongly consider it. Group homes are still kind of reluctant to open back up all the way, and we haven't taken too many people from the group homes. But for those who are attending, I am asking them to be to be vaccinated. However, we do have members that refuse to be vaccinated, which is totally their right, and we still accept them as well. Everyone is still social distancing here in Lowenstein House, and we are wearing our masks.
Yes.
So outside of that, we're trying to stay as safe as possible, especially with the new strain knocking on our front door.
Yes, sir.
Thank you for that.
Yes, sir. And I don't see Miss Susan on here, but we have an initiative here to make sure that we've gotten everybody in our AHS housing and our group homes the opportunity to get vaccinated, and they did some months ago early on. So in most cases in our group homes, and I really can't think of anybody who isn't. It may be a rare occasion where somebody is not fully vaccinated, or as we're getting some new entries, we start the vaccination process. So should that help if anybody is reaching out to any of your services and they're coming from our group homes, that's a strong initiative that Lori has for us and that she has for our staff. And they're continuously reaching out to us to make sure that we stay as informed as possible. So just to share that. And I know Ms. Marta wasn't able to make it as well, but same thing as far as the peers that are going to Turning Point, they're a part of our housing. I don't think we've opened up over Turning Point just yet. But just so you all know, again, if we do any interaction, that's something that we're strongly suggesting and trying to work through with all of our peers and people coming into our clinics here at AHS.
Thank you.
Yes,
I
sir.
appreciate that. Anyone else would like to share, update us on anything? Kirby or Avis, you guys have anything that you want to share before we get off? Anyone from the state?
Hi, everyone.
Avis?
No, I don't have anything in addition to share. Great meeting. Glad to see everyone and appreciate the attendance today. Kirby, do you have anything to add?
I don't. Great meeting.
Mm-hmm.
Great. So if we don't have anything else, the next statewide planning meeting will be on August 10th. That's for everyone across the state. That'll be August 10th. And will that be WebEx or will that be Teams?
It's WebEx, Bart.
It is WebEx, okay. I couldn't remember if we were doing WebEx for the state and Teams for the quarterly meetings. Is that so? So it is Teams for the quarterly
So
meetings?
while we're doing the virtual meetings, like we don't know what we're going to do yet for the December statewide meeting, too far out, but
Okay.
it's just easier to do WebEx for the meetings where it's like 90 plus participants, because on MS Teams, if we have individuals that call in, it interrupts the meeting. So it would be kind of a nightmare to do MS Teams for such a big meeting. So yeah, it's the WebEx, and all the information to access that meeting is on the department website.
Thank you. And the next regional meeting, Region 7 meeting, will be October 26th at 11:30. We don't have a speaker, so if anyone is interested in presenting or speaking, feel free to email Butch, Mary, or myself, and we can put you on the schedule. Just to give you an idea, pretty much anything relating to mental health or substance abuse is always an amazing topic. We've had some great speakers. If you want to provide virtual lunch, I'm okay with that as well. I don't exactly know how we do that, but if you want to throw some chicken nuggets through the screen, I'm okay with that.
Maybe we send out some gift cards or something. I don't know.
Gift cards.
Bring your own lunch.
I would like to also suggest maybe in the next meeting, we have Erin on the line now. She is a She Too facilitator for Region 7. And so just to have her give us oversight of what she does regarding the state initiative for housing for substance abuse users. So she'll talk about that next meeting if that's possible.
So are you volunteering her to be our speaker for the next meeting, Mr. Albert?
Yes, sir. You know, I'm good in draft. So, yes, sir. If she doesn't mind.
Looking forward to it. Looking forward to it.
And what's her name again?
Erin, E-R-I-N.
Oh, there you are.
Gillian. I'm here. Gillian.
All right. Miss Gillian, what usually happens is during it's probably following the exact same agenda. If in case you didn't get it, it happens around the 12:30 mark. And what you do is you'll have the platform, you'll have the floor to present whatever is appropriate at the time, and you'll have about 30 minutes to an hour to present that. Some of our speakers, they don't take 30 minutes. Some of them take an hour. It's totally up to you. No pressure whatsoever. But this is your time to actually share with the region any updates on your particular topic and how we can be involved or how we can help or how we can even benefit from it. So that's what will happen during your platform.
Okay. Well, what I'd like to see happen is I'd like to, give a little presentation about what the program is, and then open the floor for some questions. So it'll probably be half and half, so about an hour, if that's okay. What else? Should I email the formal title and that? Who should that go to for the agenda purposes?
You can send that to
So,
me if you
Mr.
want,
Butch-
Aaron. Yeah,
Okay.
I need your email address anyways. I'll get you on our email list so that you're like fully bombarded with everything.
Sounds good to me.
And Ms. Aaron, if you have an actual formal presentation that you want to share on the screen, I think, Kirby, am I correct in saying that everyone has access to share their screen if they need to? Or do they need to send it to you?
No, for these meetings, I don't have, I haven't blocked controls or anything like that. So if you need to share the screen, you should have access to do that. And if you don't, for whatever reason, I can grant it, but I have it open right now.
Okay. What I'll probably be sharing is what we call our key one pager. That's the Creating Homes Initiative. Just a little background about the program, and then we'll go into a little more detail about what it is and what we can, what our goals are for the Shelby County region.
Sounds great.
All right.
That's great.
To it. Thank y'all. Thank you, Mr.
Thank you,
Richardson.
Ms. Aaron.
And Aaron, I put my email in the chat there for you.
All right.
Hold on. Uh-oh, I'm sorry. I was talking. I said I got it. I'm grabbing it right now.
All right. Well, is there anything else? If there is nothing else, today is Tuesday, July 27th, 12:37. This meeting is adjourned. Feel free to stay on as long as Kirby will let you stay in here and party or whatever you got to do. But I'm gone. Thank y'all so much. I appreciate everyone.
Good seeing you. Glad everybody's doing well.
Good to see everybody.
Thank you.
Bye-bye.
I put my cell phone in the chat in case you need it.
Yeah, I got you.
All right.